Hi everyone, welcome to my vlog. I'm Szenan-Balance from Self-Diagnose, the Acupuncturist. Now today I have a video to show you. This video is for my webinar, for my free webinar. The topic is Acupuncture and Chinese medicine to treat Menorrhagia, which is heavy period. Now, if this is the first time you watch this video, or you have been watching my video for a while, then if you haven't subscribed to my YouTube channel yet, look at here. Like this icon, subscribe icon on YouTube, please click it and click the bell beside it. Therefore, you won't miss any of my video in the future. Now, we also have a Facebook group and Facebook page. Now, all those links are linked down below. Then please go and click it and go to our Facebook group and Facebook page, because I have been doing a live video and vlog weekly. Every month, I'm going to do one case study. Now, if you want to follow me to learn more about acupuncture and Chinese medicine to treat all sort of diseases, I would like you to join me. And I have a lot of things that to share with you for free. Now, stay awesome and let's watch what the webinar is going to talk about. Disclaimer, disclaimer, disclaimer. You must read and agree with this before you start this video. Let's start. Now, firstly, we're going to talk about heavy period today, right? And heavy menstrual bleeding. That's our topic today. How do we treat it? Firstly, we need to know about the normal period. What is normal period? Okay, so every month, every woman have a cycle, right? What a cycle is? The first day of period called day 1. Then the period should last for about 5 days or 7 days. Okay, 5 or 7 days. But normally we say 5 days is standard days. Then day 1 to day 5, bleeding, then it stops. And it keep going to day 14. Then day 14 is ovulation. And after ovulation, 14 days, then period. Then from the start of your period to the next period, normally 28 days. All right. And that's the standard one. But of course, we all, not we, I'm not a woman, sorry. Everyone's different, right? Okay. So not everyone will be the same. Not every woman will be the same. Okay. 28 days, some of them really get 28 days. Perfect. Okay. But some of them get 30 days, 32 days, 33 days. Some are only 24 days. Every 24 days, they got a period, right? So what is the normal range? So 23 to 33, all right, and between 23 to 33, but 28 is the perfect one. Okay, now what is the amount of the bleeding? We need to know that. Okay, the period comes from the lining, right? So if female are not pregnant, right, so it will, on the day 14 it release the eggs, right? So the lining keep going, right, and it keep going. If nothing happened, no embryo attached, transplant on the lining, right, and the lining is gonna go off. You know, the peel the lining off, then the lining become bleeding. So basically, the lining is the blood. It built from the blood. Okay, and so the female get period means they are not pregnant. Okay, one of the simple way. Female get pregnant, they don't get period. Okay, that is something that we need to put on our brain first, on our mind first. This knowledge we need to know about it. Okay. So how much bleeding is normal? Okay. Now, if you go to see the doctor, you know, and the doctor will ask a lot of things in here. Here is some of the question that I put in here that you should ask. Okay. What's said about Park? Yeah. Okay. About the, yeah, not this time for NJASA for the CPD. Okay, now this is about the question. Okay, the question that you should ask about in the about the period things. Okay, the age when the patient got the first period, the length of menstruations, number of days that your period lasts, number of days that your period is heavy, all this question. Okay, I'm not going to repeat all this. You should be able to know this. Okay, as an acupuncturist, okay, if you train in Chinese medicine, all this question you should be able to know it. Then what happened? I create all this, put all this question in a form. Okay, so I don't actually ask my patient all this, they just fill in and I just check all this. Okay, so you can do that too. Now we focus on the period, the amount of the, okay, so this is tampon, right? You can see 4 different tampons. Some is very heavy, right? Very heavy on the 4th one, and just a little one in the first one. Okay, that is very light. Okay, and a medium, the medium is on the 3rd one. That's between light and medium, and that is the 2nd one. Okay, and yeah, so over here, that's how my master told me that a woman, when they get bleeding, every 2 or 3 hours they need to change 1 tampon, and that's normal. Okay, that's how we figure that out. Okay, but you must ask your patient whether the tampon is like this one, the first one. If they change it every 3 to 4 hours or 2 or 3 hours, and they get the first tampon, and that is not normal at all. Okay, that means but light. Okay, so if they get it in the number 3, and that's okay, right? That is normal. Some people get number 4, and that's fine too. Okay, it's not, I won't consider it's too heavy in here. Now, if some people get it every hour, okay, every hour they change because they feel uncomfortable, and it's about hygiene. Okay, they want it to be clean, so every hour they change one. If every hour they get number 3 or number 4, and that's heavy. Okay, every hour. If every hour they change it because of hygiene, they get number 1, that's not too heavy at all. Okay, so we need to have an idea what is heavy bleeding. Now, this is just very old factions that you use. Most people know about this tampon, but that is another few type of tampon. On the middle one, I don't know what they call, actually, I can't remember. But some people use cups now. So cups pretty good, that it actually come with measurement that I can tell you how many ml that they actually empty. When they empty, they can read the ratio. So that's one way. People use cup. That's how it goes. Okay, now let's get into this patient, 47 years old, married, and first visit is 25th of February, which is last month. has been diagnosed for adenomyosis. The main complaint is this, okay, and that has been diagnosed by the ultrasounds, and non-stop menstrual bleeding, ongoing bloating. Okay, on this ongoing bloating, it's actually I asked further. I didn't put it down. It's heavy sensation. She actually feel heavy sensation in the lower abdominal. No period for the last few months. That's what she said. That in the last few months, she didn't get any period at all. Okay, 47, menopause. Okay, coming up to menopause. Then on January 2020, keep going. She got her period, bleeding. It keep going for 26 days with a lot of clots. Now in Chinese medicine, we look at that, a lot of clots. First thing we think about is the blood stasis, right? And the GP gave her high doses of progesterone for 10 days. The high doses actually stopped it. It stopped it eventually, but it came, as soon as you stop the high doses progesterone, it came back again. Then what happened? They changed it to low doses, and the low doses did not help at all, right? So why using progesterone? Using progesterone is because first we need to know when the progesterone produced in your body in the very high peak is when women release the eggs, which we call ovulation. When it's ovulation, progesterone happen. It produces more. It doesn't mean that progesterone didn't produce between period and ovulation, between day 1 to day 14. It does, but it's just very low. Okay, but as soon as ovulation happen, then progesterone become very high. Then progesterone, according to Chinese medicine, we give it a name called womb hormone. It belongs to yang, so it will get woman's temperature higher. Okay. Then when progesterone happen, if it happen with embryo transplant properly on the lining, on the uterus, then progesterone will keep high. It won't drop. And progesterone is one of the cause, if it drop, is one of the cause of miscarriage. So the right amount of progesterone is important for pregnancy. That's one thing. And when pregnant, they don't get period, right? No bleeding. That is because the progesterone is very high. Then stop the bleeding. That is why in Western medicines, they use progesterone to stop bleeding, because it feeds you progesterone. When your body progesterone is high, then it actually stops the bleeding. And it's pretty lucky that this patient worked for that, because some patients didn't actually work with progesterone. Progesterone. Okay, keep going. So when this all thing happened, that make this patient so anxious, and she did mention about all the bleeding. It will bleed more due to physical activities. She can't go out for social or staying overnight due to bleeding, because she need to clean it up. It's embarrassed for her, and she didn't know how to deal with it. And every day she get anxious, she got anxiety because of that. Now anxiety, in Chinese medicine, we go to heart or spleen, right? Now, while I go through it, we know when patient talk about, we know which organ out of balance. As a teacher, she works as a teacher. She need to work every day, of course, standing and walking a lot. And she worried that she's actually in an unmanaged situation, okay? Because she walk around and standing a lot, then that bleed a lot. And pretty unmanaged, difficult for her to manage. She need to change it and clean it, all this thing, right? It actually wake her up every night to change. And questions how often, right? Change pads every hour at least. Every hour, right? It stayed about number 3 or 4 that will just show you before. So it's quite heavy. Every hour, number 3 or 4, and that's pretty heavy. Okay, getting very tired and headaches every day, and thirsty. Right. So tired because losing blood, headache because losing blood, and thirsty. So headache and thirsty come together. Why is that? You probably have experienced, or people say, well, I got a headache because I dehydrated. Not enough water in the body. When losing blood, what is made out of blood? What is the resources in the blood? One of the bigger things in the blood is actually water. 60 to 70 of water in the blood. So when you lose a lot of blood, which means you lose a lot of water, that's why patients feel thirsty and headache. Now you can tell that, well, this is because losing a lot of blood deficiency. Now we have blood stasis, blood deficiency as well, right? Anxious, spleen weak, or heart functions weak, right? You see that audio is not clear. Are you guys hearing me all right? So if audio is not clear, it probably is in your internet problem, because the rest of it pretty good. Thank you. Super. Yep, very clear. Hi, Aaron. Pretty good. Okay, now next. She actually done a blood test, and she told me, I said, well, how was the blood test? How is the iron? He said, iron's fine. I said, then think about it. Iron should not be normal. And I asked her, when did you take the blood test? She said, a month ago. Of course, a month ago. A month ago, that was when she went to see her doctor. And her doctor, she just started, her doctor get a blood test for her. And that was fine. But it doesn't mean right now it's fine. It was a month ago. And she keep bleeding for so long. And the amount is increasing. And every hour she need to change it. So I'm pretty sure that her iron is low as well. Okay. So even though she said iron is fine. But I said, well, not really. Because it's a month ago. Right. So hot flusher. With sweaty in the morning, and that is another sign of what do you call menopause, right? 47 years old. So yes, come to menopause, the period will sometimes stop, sometimes come a lot. And that's one of the problem. There's family history, health history. Just okay. Now, second main complaint. This is, I'm a bit lazy. I just copy and paste on here. That's on a form. Okay. She mentioned about tight left hip. It's actually not just tight, it's painful as well. 5 to 6 out of 10. I asked her when did it begin, being tied off and on for few years. What made it worse? Sitting down for extended period. So what makes it better? Exercise and walking help. What have you done about this? Physiotherapies. How does this problem interfere with your daily activities? It actually wake her up at night time, not comfortable at night. And walking, yeah, look, it felt better when she exercised and walk, but I think sometimes walking is actually interfere with the pain as well. So she was asking, this is what she wants to come here for. Heavy period gone, ease to a manageable state. Her hip, left hip looser, and happy sleeping well. Lost some weight to help my overall health, like the joint pain. The important thing, okay, she said, I'm feeling very limited by heavy bleeding, worried about staying overnight away from home, long journeys or situations where I can't get to bathroom easily to manage flow. So this is something that why we ask so many questions. I always ask a patient, when doesn't matter what they have, they come to see me. If I ask them, with this problem, does it stop you or slow you down your activities or anything that you want to do or you enjoy to do, you know? Because patient come to you, it may not because of the bleeding, or it may not because of the pain. It's because the bleeding or the pain actually interfere with their life, with something that slow down, something that they work to and love to, they enjoy to. You see, there's something that it actually affect her lifestyle. That's why she come in. If it doesn't, if it's just a little bit of bleeding, it comes and go. And if she can manage it, she won't come in. You see, they still have problems. A lot of people out there, they have pain every day, but they won't come to see you because it's not bad enough to interfere in their life, or they can still manage it, right? So if we are treating pain, this is not the problem. The real problem in the patient that actually come in, yes, because of pain, but it's because pain stopped something that they love to do, or pain actually slowed down something that they love to do. That's why they come in. So we need to find out the real reason and write it down. Not until you get it all, get them back to normal activities, and your job is not done yet. That's what I want to say. Okay, let's keep going with heart and small intestine. So trouble staying asleep, get to sleeping is fine, but just trouble staying asleep and need couple hours to get back to sleep. If she stay up, if she wake up at night time, she actually need couple hours. When she get up at night time, is about between 2 and 3 a.m. So between 11 to 1 is gallbladder time. Between 2 and 3 is liver time. So we know liver function out of balance too. And heart control sleeping. So getting up, couldn't get back to sleep, and that's heart out of balance as well. So lung and large intestine conditions that she suffered from hay fever. But when she came in here, hay fever season is gone. She didn't have any symptoms at all. So we know the lung and large intestine condition, there is one condition here, hay fever, and happen every year. Let's have a look, liver and gallbladder symptoms, signs. Dizziness. Recently, she suffered from dizziness and due to heavy bleeding. All right, dizziness. That is pretty understandable, right? Dizziness due to heavy period. And she always had low blood pressure, and that is one of the other reasons that causing dizziness as well. Headache due to bleeding, that we mentioned that before. Neck and shoulder tension, tightness, pain, feeling tight and twisted. That's all joint problem. Tendons as well. Occasionally pain in the joints. Decreased night vision, but glasses helps. So all this symptom, they all related to liver and gallbladder. Further on, spleen and stomach. Okay, spleen and stomach, sugar craving. Sugar craving is actually spleen qi deficiency and weight gain. All right, let's have a look. If you diagnose this patient, what would you diagnose? All this information, what would you put it in? Before I actually show you how I treat it, how I diagnose. Okay, and the tongue, I actually got a picture of the tongue. I just didn't have time to put it in here. It's actually on my iPad. I couldn't put it aside to my computer. Too much processors, I didn't put it in there. So tongue, big and swollen, teeth marks, thick coating was in the bottom of the tongue. So thick coating, we say, oh, this patient have what? Probably fluid problem, water retention, or mucus, or dampness, right? Thick coating, that's white. Teeth mark, we know, oh, spleen qi deficiency, right? Tongue swelling, the tongue's pretty big. And the pulse show that the kidney pulse weak. This is my pulse diagnosis. I don't do 28 pulses. Okay, now let's discuss 脾气虚, okay? 肝血虚, okay? Martin, thank you. For all this information that you get, what is your diagnosis? Liver invading, okay? Liver qi stagnation, right? We put it in here. To stomach and spleen, thank you, Szenan. What else? There's nothing wrong or right, okay? Just put up whatever you see. Liver qi stagnation, very good. Liver qi stagnation, injured stomach and spleen, very good. What about fire? I don't know. What about fire? We can all discuss about this. What about fire? Is there anything that showing fire? Something that can relate to fire is thirsty, right? But the thirst is caused by losing water, losing blood. Is it really fire? Okay. And another thing that we may consider fire is hot flusher every morning, right? What sort of fire is that? Where does the fire come from? Thirsty because of spleen and stomach deficiency, right? Yep. Liver fire. Okay. Kidney control the 2 E's. Yep. The E deficiency, right? It causes heat. It causes hot flusher. It causes thirsty. That makes sense too, you know. And the losing blood a lot, that's E deficiency. You know, blood deficiency, and they cause the heat, and that makes sense too, right? Yep. All make sense. Heart symptom also. And become pathological water. Some people get headache due to fire too. Yes. What is because of spleen cannot hold the blood? Makes sense. Okay, thank you for discussion. Spleen qi deficiency. Because the liver injured. Spleen and spleen qi deficiency. So because the liver against spleen. liver qi stagnation in liver against the spleen and spleen qi deficiency that causing the problem. That makes sense too. Okay. Okay, thank you for joining in and discuss this. That's fantastic. Okay. Any more answer for that? Again, there's nothing wrong or right, okay? Now I think when we have all this information, it can be anything. It can be anything. When I put it down to spleen, you can see, oh, spleen function in here. Tongue calling about spleen as well. We have liver out of balance, dizziness or distinct headaches can be that too. Hay fever, heart problem, sleeping problem, and sleeping problem is wake up between 2 and 3, okay, and that is liver time as well, and that the period got, the period hot flusher, it could be anything in there, and the period's anxious, it can be heart, it can be spleen as well, and people say anxious liver as well. Okay, so what it really is, what is the real answer then? Because we discussed a lot in here, right? And we have clots as well. Are you concerned about blood clots of blood stasis? Then what is the formula that you actually choose, and what do you actually needle? What point do you use according to your own diagnose? Kidney yin deficiency, they would say. Liver 血虚 with stagnation qi with spleen qi deficiency. Thank you, David. So David say is kidney yin deficiency, liver blood deficiency, spleen qi deficiency, and liver qi stagnation. Right, all this thing all makes sense. So what is the reason makes spleen sinking? Stop bleeding first. Stop bleeding first. Yes. How do you stop bleeding? And what do we normally use? What is the best acupuncture for stop bleeding? What is the best acupuncture point for stop bleeding? What herb do you use? Can you name some of them, please? 血海, great point, 血海. We do 百会, right? 220. Spleen 1 with moxa and liver 1 with moxa too. That's fantastic, yeah. Spleen 10. Okay, I need to check what's spleen 10. Spleen 10 is 血海, yes, that's right. 隐白, that is隐白 spleen 1. Spleen 8. Spleen 8 is 地基, yeah, 地基, spleen 8. Spleen 10 is 血海. What else? We have 血海 spleen 10, where people say spleen 1, and I'll add on with one of them that we would use as spleen 1 and liver 1 with moxa as well. Spleen qi clip point. Spleen qi clip point. What point is that one? 八疗. Okay. 八疗 with moxa, moxibustion, 八疗. Great one. What else? Kenny, I can see that you're typing. Looking forward to see your answer. Oh, 隐白八疗 moxibustion too. Yeah, thank you. Thank you, Ethan Ling. 百惠, yes. 百惠, I think it's called 220, right? With moxa. That's what we normally do, right? Oh, great point. 葛苏. Okay, 葛苏. 葛苏. Let's see what 葛苏is. Let me check 葛苏 for you guys. Someone said 葛苏. Brainstorming, right? 葛苏 is... Oops. Don't have 葛苏over here. Let's have a look. 葛关葛苏. Okay, I just about there. 葛苏 is UB17. Stomach 36. Work with moxibustion. Yes. 葛苏 is bladder 17. Alright, that's it. What formula would you use on this case based on your own diagnose according to TCM? 逍遥散, okay, 逍遥散 combined with 二仙汤, great formula. 二仙汤, yep. UB7 backsu point, that's 葛苏. Yep. What else? So, Ethan Ling said, 逍遥散 with 二仙汤. What other formulas will you use on this case based on your own diagnose? Again, nothing wrong or right, okay? Just based on your diagnosis. We want to see what, because it comes to Chinese medicine, everyone can have their own diagnosis, right? So it's very interesting to see what idea that do you have. High doses of Szenan, above 50 grams, can stop bleeding too. That's correct. That's correct. Or we used to use the formula called 当归补血汤, right? Which is only 当归 and 黄芪. 当归补血汤. 当归补血汤 plus 生地, high doses 生地, and that can stop the bleeding as well. 桂枝茯苓丸. Why do you use 桂枝茯苓丸? Of course, if your diagnosis this patient is because of blood stasis that causing the bleeding, then yes, 当归茯苓丸. But only using 当归茯苓丸, in this case, it doesn't really fit in because she has a lot of other symptoms as well. That's my thinking, okay, but nothing wrong or right. Right? Okay, let's continue. Thank you for all your join in and discuss this. 补中益气汤, great. 凯生写补中益气汤, 生阳益胃汤, 生阳益胃汤. If qi deficiency, 生阳益胃汤. 补中益气汤, great formula. Okay, now I actually make a plan for this patient. Okay, our plan, the goal is to reduce bleeding, then eventually stop bleeding and get you back to normal life. All right, to balance organs function according to TCM, and to balance hormone and stop hip pain. I'm not just treating the heavy bleeding. I treat all the organs, and when I treat all the organs, I will actually get benefit from reduce the heat pain, to balance emotional energy. So think about why this patient had heat pain for a long time and not be able to heal, right? Why is that? Does the heat pain actually link to the heavy period? We need to think about this. There's something there. If patient have pain on the joint, it should heal. That's been few years that this patient hasn't been healed. It's actually getting worse. Thyroid channel, right? So our goal for this treatment action plan so this is our goal. The 3 of them. I put down one is to balance emotional energy, anxiety. That's something that we need to look after as well. Now, then there's the plan. The plan is 1 acupuncture weekly. 1 for 4 weeks, okay? 1 herbal prescription per week for 4 weeks. 4 weeks worth of Chinese herbs. 1 re-exam at the end of the treatment plan. Okay, so after 4 weeks, herbs and acupuncture full time, then we need to sit down for re-examination to see what has been happening, what has been getting better, what has not been changed, what has gotten worse. Then 6 is dietary reviews and suggestions. Emotional daily practice, 7. 3 to 1 acupressure program. So 6, 7, 8 are for all my patients, right? Because I believe that changing lifestyle will help my patient get better and stay healthy. So that is important. So I put it all into video so patient will watch it at home. And when they come in next time, and I'll ask them what question, any question about all this video, right? There's education as well, and a lifestyle change is very important. Again, not everyone can follow, but we give them, we don't force them, we give them information. Information is information, and educate your patient. This is what we do. Now, when patient changes diet, in some cases, you see that the big difference. In some patients, they get better and better and better, but they can't get any further. Then we go back to, hey, have you been changing your diet yet? If they haven't, you ask them to get further. Then when they change, they actually get even better. That happened to our clinic a lot. So I have asked you about how to diagnose, right? You name a lot of them. Again, there is nothing right or wrong, okay? We won't say, oh, you're wrong, I'm right. I'm not discussing over this. I just have other things on other direction and angle to look at this patient. I look at this on a different way. So I ask all this question, all the question that information that I collect from my patient. I actually send them a form, they fill in, and they send it back to me. And when they come into a clinic, they have to watch a video for 5 to 6 minutes, a video, before they actually can see us, our practitioner. And when they see our practitioner, we go through that form and we tell them which organ imbalance. For all this information is actually helping me for me to measuring a patient's progress, whether my acupuncture and Chinese herb works for them or not. So in the next, after a month on the re-examination, we need to use all this information. We're going to go through all this to talk about which one has been improved, which one has not been improved. That is my main purpose. To be honest, in reality, in the case, I don't use all this information to diagnose at all. Okay? To help me to diagnose, I don't use it at all. I use many pose and look. Okay? Here is my diagnosis and treatment. My treatment using GE acupuncture, and the diagnosis is the right sun. The right sun is my diagnosis, and I use the treatment of right sun water. Okay, right sun means the right leg. By looking, the right leg is shorter. The left leg is longer. That is my looking. So this patient have a structural problem. That's the first thing. And how do I treat this? On the right side, I use the right water sun. Right water sun point is actually the point around level 10 and level 11. So the top image, it shows level 10 and level 11 point. Around here, I choose a point to needle. The second point I've chosen for this patient is water jiang, which is the longer leg on the left side. And the point is actually around GB29. So the bottom of the image, you can see the GB29. Okay, those are the 2 points I needle. As soon as I finish those 2 needles, and I ask the patient the hip pain, and she said the hip pain is gone. So in this case, the structure will change. So I treat the structure, and the uterus is actually on the water area. Okay, on the water area. So treating those 2 points actually will help the uterus, help the heavy bleeding as well. So those are the 2 points that I mainly use to treat structural problem. According to GE diagnosed by looking. And I have to make a point in here is this patient yin and yang rotation. So the left side is actually yin, the left leg, and the right leg is yang. We're going to treat the yin yang as well, but I don't treat on GE acupuncture. It comes with yin yang, Shenjiang, and Chulu. 3 different systems. If any of the system out of balance, it can cause pain and it cause problem. Okay, so we actually don't know how which system causing the pain or which system causing the bleeding, but we go through to check the patient. Then how do I find out which diagnose actually linked to the pain? So I needle it and check it out. So first, by looking, I figured out that the yin yang has a problem out of balance and Shenjiang out of balance. For this patient, I choose Shenjiang to treat with Shenjiang and see whether Shenjiang causing the pain or not. Yes, the answer is yes, because as soon as I needle those 2 points, the pain's gone, disappeared. Then I didn't bother to treat yin yang imbalance because I leave it the next time. If next time the patient feel pain, I'm going to treat it for yin yang. If yin yang work, in the third time, I'm going to treat it both because those 2 systems actually out of balance causing the pain together. If I treated just Shenjiang, it works. And the next time I treat yin yang, it didn't work. Then I'll go back to Shenjiang and I'll just focus on Shenjiang. I won't bother with yin yang. That's how I test it out. Okay, just letting you know what I'm doing about GE acupuncture. Then the second acupuncture, I need to mention about GE acupuncture. I don't actually leave the needle there. I just do quick needle, stimulate the point, take it out, stimulate the point, take it out. That's it. And it works very well for this patient. Then second strategy in here, I use Dr. Tan and Master Pan post-diagnose Magical 12 as my strategy for treating all the organs. Why do I treat all the organs? Because the patient, when I collect all the information, all organ out of balance. So I treat all organs. According to Dr. Tan's balance method, when all organs are out of balance, all meridian involved with the pain or conditions, then the best strategy for it is Magical 12. Then when I treat Magical 12, I don't choose image to guide me to find the acupuncture point. I actually using pulse, 把脉, checking the pulse, and the pulse actually showing that kidney weak kidney. So my diagnosis is weak kidney. So I just focus on treating kidneys. So all the information, every organ's out of balance, but which one is the most that we need to focus on? Then kidney. So in this strategy, I focus on treating kidney according to the pulse. Now, and I use iron triangle. So what is iron triangle? We have a what do you call it? A treatment principle that call, if it's weak, in a weak condition, you treat the mother. You tonicify the mother, right? Let's say, in this case, kidney is water, right? If water is weak, you're gonna treat the mother. Who is the water's mother? That is metal, right? Metal is the water's mother. Which means when you tonicify water, you need to tonicify metal. When metal improve, you tonify metal and the water will be stronger. Does it make sense to you? Shannon, yes. So do you start with structure before yin-yang imbalance? Yes. In this case, yes. But sometimes I use yin-yang. Doesn't really matter. Because I just want to test out. I know I'm going to treat it just one by one. For this case, because the point in Xinjiang is much closer to the, and according to the Chinese medicine acupuncture point, those points will actually help the heavy period. So I started to use Xinjiang instead of yin-yang. Okay. Now, we're going to tonify. This is important though. If you know this, you can do it yourself in your clinic. It's so simple. But of course, you need to know how to diagnose first. Okay. Because for all, you guys just mentioned, for all information that we collected from the patient, or the question we ask and they give answer to us, the patient give answer to us, you can go to, oh, it's spleen, qi, it's liver, blah, 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 a lot, right? But those are confusing. What is the real thing in here? I figured it out. It's actually from the post. The post one lie, okay? So the weakness in kidney. Now, okay, we're gonna improve, tonify kidney. We need to tonify metal. Okay, we know. Then what happened now is, what about if we reduce fire? The water against fire, right? If fire is strong, the water going to go down. Does it make sense? If the water is strong, the fire is going to go down. So now we know we're going to tonify water. The water need to go up. What about fire? Fire need to go down. So what happened in here? We reduce fire. That's what I talk about, the iron triangle. We tonify water, tonify metal, 2 tonify, 1 reduce. Reduce what? Reduce fire. When you reduce fire, the water will go up. And the fire actually against metal, right? If the fire go up, the metal go down. If the metal go up, the fire go down. So once you reduce the fire go down, the metal is going up, right? So when you reduce fire, the metal and the kidney, which is water, going to be stronger. That's why we reduce fire, not the others. Now we don't have to treat liver in here, like the wood and what? The wood and earth, which is spleen. You don't have to needle it. But if you want to, that's okay too. Now basically, look at the chart on the top of the chart. Okay, Mexico 12 of kidney weak, iron triangle. When you treat the kidney, the water is kidney and bladder, right? So kidney, you use kidney 7, tonify. UB, you use UB 67, tonify. Lung, you use lung 9, tonify. Large intestine, you use large intestine 11, tonify. Now, heart is fire, right? We need to reduce heart 7. And reduce small intestine 8. That's it. That is what you need to do, according to the pulse, using kidney weak iron triangle. But the others, all organs are sick as well. All organs, all meridian involved in this case. So what do we do for the others meridians? Simple. We just put Harari point, 本穴. Pericardium, you just put pericardium 8. Sanjiao, you choose Sanjiao 6. Spleen, you choose spleen 3. Stomach, you choose stomach 36. Liver, we choose liver 1. GB, gallbladder, we choose gallbladder 41. That's Harari point. And it all added all up, 12 magical point. Now how do we put needle in? If I put needle in for here, look at the camera of me. If I put in on that side, on the left side, on the opposite leg, which is right leg, that's in meridian as well. So 3 hand in here, 3 hand yang in here. And of course, that side will be 3 hand yang, and then 3 foot yang on the opposite side. You can do the opposite, like this in. If you put 3 in here, hand in here, then that will be 3 hand yang. Sorry, that will be 3 foot yang on that side. And that, if you're on cell phone, you need to switch to look at my face, not look at the PowerPoint now. All right, if this is 3 hand in, then that will be 3 foot yang. 3 foot in, sorry, 3 foot in, 3 hand yang. Then this side will be 3 hand yang. The opposite side of this hand, that's this leg, 3 foot yang. That's it. That's how you do magical 12. This is global balance, treating the organs. The next strategy for this patient, I actually asked the patient to do on the right hand. This is my right hand on here. On the 3 hand in meridian, get my patient to do acupressure point once a day. Once a day on 3 hand meridian. Hand in meridian on the right hand. The reason I choose right hand is because this patient, while looking, the left legs is in. So on the opposite hand is in as well. So I need her to massage acupressure point only on right hand 3-in, not on the left hand, because left hand is yang. We're going to talk about which one is yin and yang later on. So the reason I ask patients to do this from the wrist to elbow, that's represent all the internal organs. So when we collect all the information, we find all organs out of balance. That's why I ask patients to do acupressure point over there. And this method over here, according to 黄帝内经, is image. In 黄帝内经, it's called 尺夫脉诊. Okay, 尺夫脉诊. The image is all from 黄帝内经. We're not going to talk too much about here. We're going to keep going. Okay. Now I give Chinese herbs. Look at here. On the top of the chart. How many acupuncture point in here? On the kidney weak iron triangle. 6 points. 6 different points, right? Then when I use Chinese herbs, I do tonify kidney and bladder, then tonify lung and large intestine, and reduce heart and small intestine. Let me ask you a question. When I ask you about the acupuncture point, right? Some people said what? Spleen. Hang on. You guys said about spleen 1, right? And you guys said about spleen 8, spleen 10, right? And 210, right? Now, let me ask you a question. When you do all this point, do you have a formula or herbs to use according to your acupuncture point? Let me repeat my question. Do you have herbs or formula to use for this patient according to your acupuncture point? When you needle this point, you use this herbs. When you needle this point, you use this herbs. When you tonify this point, you use certain herbs. Do you have that? Do you have this method at all? The reason I ask this question is, for all of us using acupuncture, I was there too, right? When we do acupuncture, we have one thinking. We put needle in. But when you come to Chinese herbs, you can't actually link it all together. You know, you will do some point, but you use some certain, you may use the same point for 2 acupuncturists. You use 竹山里, but some people, when they use 竹山里and they come to here, they use 补充益气汤. And some patients actually, some people use 黄芪, 当归补血汤. 2 different thinking. No, right? Yeah. So why is that? Too complicated. Yes, I know. Why is that? It shouldn't be, right? Because acupuncture and Chinese herbs, they are both Chinese medicines. Why would those, when you prescribe this and a needle, why they don't actually match up together? That is my question. For many, many years, I did that too. I prescribed classic formula, 经方, 伤寒论经方. I love it. To be honest, I love it. Then when I do acupuncture, I struggle. I thought, oh, okay, what point actually fit this formula, classic formula? You know, I actually have a book that's one of the great acupuncturists. It actually translate all the 条文, all the 伤寒论chapter, all the chapter, each chapter, what point to use. And the great acupuncturist actually suggests the point. When I read it all through, I said, forget about it. It's too difficult because it doesn't really make sense. It's all about his experience. It doesn't base on the theory at all. Some of them can link with theory, but a lot of them it can't. I still got the book. I love the book as well, but it's difficult to learn. What is the book's name? 姓丹的，我忘了叫什么名。I can find it out. It called 伤寒针灸 or 伤寒针刺, something like that. Yeah. Okay, let me show you. Now you see on the acupuncture point, all right? I use 6 point, right? 2 point tonify on water, 2 point tonify on metal, which is lung and large intestine, and 2 point reduce on heart and small intestine. That is the formula I give my patient. 生地, 茯苓. Okay. I'm sorry, I don't know about the English. I learned in Chinese, but I hope that when I say 生地 and 茯苓, you can look at the English, okay? That's right, 伤寒论针灸配穴. I think that is the books. Let's Google it. I'm pretty sure that is the book. That's for many years ago, because when I was in university, yeah, 丹玉堂. That's right, 丹玉堂. That's the book. If you're interested about this book, if you can read Chinese and go for this book. But I'll tell you, it's rather complicated. That's right. I've got this book. I read that book. Very difficult. Not easy. Not easy, but it's a great book. Yeah, if you can follow it. You have to be very, not in English. I don't know. You can check it out. I don't know about in English. Okay, but, okay. Now, 生地 and 茯苓are both tonified water. 细辛 and 五味子 are both for tonified metal. 玄附花 and 黄连 are both reduce fire. So when I have the principle of my needles and I use those points, then when I come to herbs, I have herbs for all these points. Interesting, right? So when I do acupuncture on that way, I do herbs on that way. But this is only, when I say acupuncture, I only talk about if I do it according to 5 elements theory. If I do GE, sorry, I don't have any herbs for it. If I do image according to balance method acupuncture, sorry, I don't have herbs for it. Alright? Only if I choose 5 element points, 五蔬 point. According to 五蔬 point, and I choose the point to treat my patient, I use 5 element theory, then I would have herbs for it. I put those 6 herbs in tea bag for 7 days. So the patient take 1 tea bag with hot water and sip throughout the day. They don't have to cook it. The 20th of February, the patient came back and said no bleeding and no left hip pain and just tight in the hip. So in this case, in the follow-up, and the patient said no bleeding, right? That's great. But no hip pain as well. No hip pain either. So right sun is working well. According to GE, right sun's working very well as she has not got any pain in left hip. So no pain today, right? Keep going with right sun. And I will test out left in if she has pain in the clinic next time. There's no point for me to test out the yin and yang imbalance according to GE. Why is that? Because there is no symptoms. I don't know whether it's right or not. But anyway, since there's no symptom, I know the last time was right. It may just cause from Shenjiang imbalance, right? So I keep treating Shenjiang, the same point. Fortunate in this case, so as you can see, the right Shen and the point GE point are all the same. Your right water Shen and level 10 and level 11, and left water Jiang, the points around GB 29. Okay, and then the magical 12 Tan and Pan method combined together, and the pose it still represent kidney weak. So I use kidney weak of magical 12. So no change on the point. The reason I don't change the point, the magical 12 strategy with kidney weak iron triangle, it is not because of this patient is getting better. So I keep going with this point. It is because this patient pose present the same diagnosis as last time. That's why I don't change it. So don't get the wrong idea that because this patient worked well, everything getting better, so I keep the same strategy. That is not what I do when it comes to magical 12. When it comes to triangle, iron triangle, that's because the diagnosis of the pose are the same was the same as last time. That's why I keep the same strategy. Okay, let's go to the next, and I'll answer you the question, Winnie. You say, what are the portion of each of the herbs? Good question. So Shanti is 6, Fuling is 1. So 6, you can use 6 gram or 1 gram, or you can use 0.6 gram or 0.1 gram. You know, and you can use 6 milligram or 1 milligram. For me, I don't use gram. I just use spoon. I use very small spoon, and I use 科学中药 herbal powder from Taiwan. I don't use raw herbs at all. I don't use raw herb powder at all, because raw herb powder, if you're going to raw herbs and feed it to your patient, we're just not sure about the heavy metal things. You just not sure about whether there's any bacterial or virus in the herbs. Okay, so I don't use those powder at all, raw powder. All my powder has been cooked, has been processed with heat. All right, so I make sure that they are on a good quality. That is why I use them. I don't want to feed my patient bad quality herbs. Please, can you share your powder supplier? Yes, Xianfeng. It's called Xianfeng from Taiwan. So the post determines to do the same of the change for change point. That's right. When it comes to magical 12, yes, that's right. But when on GE, I use the GE diagnose. It's different with the post. So I combine GE and magical 12 together. One is more treating the organs, one is treating the structure. So 2 different things. So the post determine change to or keep the same of result is positive. Even though the result is positive, the result is good, if the post change, I will change the point. So I change the point not because the patient tell me they are feeling good. I change the point because the diagnosis change. Always go with diagnose. Okay, that's 27th. Okay, this is a bit different here this time. 27th of February. No bleeding, which is good. So 3rd week. No bleeding. A bit of left hip pain and tightness in the left hip. So when you walk on that day, 27th, the hip is a bit painful. That's great. Why do I say that's great? Because I can test out whether yin yang imbalance got to do with left hip pain or not. And she also said that the head turning to the right, feeling a bit pain and lock up. So as you can see here today, on the GE, I tested out left in water point for her left hip pain. Left in, so I choose left water point, left water in 1 point, number 1 point, which is in Ningquan spleen 9, around spleen 9. And water in number 2 point, 2 chun behind GB 29. That's in point as well. And on the right side, if left is in, then right is yang leg. Okay. So on the right yang leg, I use 足三里. Again, for those points that I just mentioned, those points are only for quick acupuncture. I don't leave the needle there. Right. Then again, quick needle done for the structure, and the patient felt better, no pain again. Wow, that's great. And I said, well, now we figured out yin-yang imbalance causing hip pain. Why do I say that? Because when I needle yin-yang imbalance, then the hip pain got better. Right? If I needle the yin-yang imbalance of water, the hip pain still the same, I know, well, yin-yang may not causing any pain for this patient at all. So I'll go back to Shenjiang, because I have tested out that Shenjiang has worked for this patient. Okay, that's how I test it out. Next, well, the post-diagnose still presenting the kidney weak. So no change for medical 12 of kidney weak iron triangle. So keep the same point, as you can see that. Now on the 5th of February, I type the Xianfeng. This is the company that I use for the herbs. We actually supply the herbs if you're in New Zealand. Let me type up the name in Chinese for you if you can read Chinese. Xianfeng, not Xianfeng. Okay. Slide 24 again. Yes, I can. No bleeding, a bit of left hip pain and tightness in the left hip. Head turning to the right, feeling a bit of pain of the neck. No problem. So that will be the same. For this treatment, a bit different is in GE. As you can see that GE, that's different. But for the acupressure point and Tan and Pan acupuncture combined together, no different for those two. Then, okay, on the 5th of March, and of course, no bleeding again, that's great, right? And hip pain now, sorry, no hip pain now, no hip pain, sorry, that was wrong. There was something wrong in here. It should be no hip pain now. Used to feeling dislocated left hip joint, okay, and it's getting worse. She told me it's getting worse. felt it daily. She used to get it very bad. And it's gone since last week. So since last week, we treat yin yang. The dislocated joint issue has been gone, hasn't been happening. It used to be feeling that every day, like the joint actually came out of the hip. Because of that, you know, so we figured out the yin yang imbalance of GE and Shen Jiang imbalance of GE by looking. You know, we can tell one leg is shorter, the other side rotation, one side out, one side in. So that's yin yang. And one side is shorter, the other side is longer, that's Shen Jiang. Those two, we needle it, and we tested out those two individually. You know, I use one, not the other. And the next time I use one and not the others. And I test out both working. So in this time, I actually treat both. Treat yin yang and Shen Jiang. And the point are same as before. So I'm not going to repeat this. And again, the pole still represented kidney weak. So I didn't actually change the magical 12 of kidney weak iron triangle. So on the 4 acupuncture treatments, each time I use the same point of magical 12 of kidney weak iron triangle. And yes, I didn't change all the herbs at all. All the herbs are just in tea bag, 6 different herbs. And the potion is 619427, as you can see. And all this are very, very little herbs that I use. I probably have the, I don't know whether I have the teaspoon for you or not. No, I don't have the teaspoon from here. I have video how I made up the herbs. Okay, I use very small teaspoon. But anyway, okay. I think you may have some question about the herbs. I'm going to talk about the herbs a little bit. This is the how I prescribe the herbs, okay? Let's look at the page on the bottom. You can see that there's 5 different aspects, right? 5 different angles that represent 5 elements. On the side that facing to right, I think you must see on the right top, going to the right top, okay? And on that side, for example, this is earth. This is earth and Chinese medicine. So earth, in this case, we're going to talk about under earth of spleen. Spleen and stomach, right? Let's just say about earth of spleen. On 5 elements, you have 5 different acupuncture points, right? On the spleen meridian, belong to earth. Spleen 3, yellow. No, spleen 3 is not wood, right? Spleen 3 is actually earth. My bad. Spleen 3 is earth, okay? I put it on the wrong. Then spleen 5 is metal. Spleen 9, water. Spleen 1 is not green. Spleen 1 is wood. That's my bad. I'm so sorry. Spleen 2 is fire. Okay, that is the 5 element point on spleen meridian. We call Wu Su points. Now, how did I get to, when I choose this point, I know the exact herbs, right? On the top of the image, you can see here. Ginseng, when you needle spleen 3, that's earth, right? Then you prescribe ginseng. When you needle spleen 5 on the top, that's metal of spleen meridian, right? Then you prescribe mai dong. The English, you can read it in here. When you needle spleen 9, that's water point of spleen, you prescribe Phua Ltd or 甘草 licorice. When you needle spleen 1, which is the wood of the spleen meridian, the wood point, the spleen 1, then you prescribe licorice. When you needle spleen 2, which is the fire point of spleen meridian, then you prescribe red dates. This method, okay, this 5-element method of herbs, it's actually from Tang Ye Jing. I typed the pinyin for you. Yeah. Here you go. What is Tang Ye Jing? Now we all know about Sang Han Lun, right? Sang Han Lun is classic formula, right? Zhang Zhongjing get all the formula from other books, from 11 different books, collect all the classic formula and make it into Sang Han Zha Bing Lun. Then we call Sang Han Lun formula, we call Jing Fang classic formula. Then one of the books that's from collected by collected the formula into Sang Han Lun is called Tang Ye Jing. So Tang Ye Jing formula in Sang Han Lun. So Tang Ye Jing formula, it's also called Jing Fang classic formula. Then how do you make classic formula? You have to have a theory, and the theory called Tang Ye Jing Fa. And the theory is in here. And this page, you can see that on the top, this is Tang Ye Jing Fa, Tang Ye Jing Tu. Okay, so according to this, when you know about this theory, you know how to needle, then you know how to prescribe the herbs. Simple as. I'm gonna post a link for you guys. Okay. As bonus, a free medical aid to treat heart disease, respiratory diseases, and digestive diseases webinar. So some of me have got it already, so don't worry if you got it already. So just for those people, you're new to me, okay, and to my webinar, there's some bonus for you. Please write a Google review for one of our clinic. So step 1, sign in your Google Mail account first, then click this link. So I just post this link to you. That's actually go to, when you click it, it go get you into our web page on a review on our website, and choose one of the Google icon. Okay, as you can see that 3 of them in here. So you can choose one to click one. Okay, if you post it in the past, you can post another one if you wanted to. There are 3 different branches for our clinic. So the Google icon, and write a honest Google review about Szenan's vlog and webinar. Then the second step is please screenshot your review and send it to info@acupuncture-tcmschool.com, so my team will send you the bonus video link to you. Okay, so that is the email address. I'm gonna post it to you. Okay, attention, if you have any question or suggestions, please send email to us. Do not ask any question or write your suggestion on our Google review. So if you don't want any of my bonus webinars, you don't need to leave me any Google reviews at all. Okay, that's just for if you wanted to. Okay, Ming Cheng, that's it for tonight. If you have any question, you can ask me right now.